I want to take a moment to look back at this year and commemorate and recognize some of our health and social justice accomplishments that we've managed to do in the past couple of months. So, with that, let's run through our top 10 list of health justice accomplishments of 2014. At number 10, we've got the Physician Payment Sunshine Act. In particular, I'm proud of a website called openpayments.cms.gov. The Sunshine Act requires drug and device companies to publicly report their payments, gifts, honoraria, all kinds of other monies that they provide to healthcare providers and teaching hospitals. They have to do this reporting every year, and that information is searchable, and it is part of a database on openpayments.cms.gov. The National Physicians Alliance has advocated for the Sunshine Act for a long time because there are lots and lots of dangers to patients when the drug and device companies and the doctors are a little bit too financially cozy. So we still have a lot of work to do, but the Sunshine Act is up and running with this website and with a couple of other provisions that got kicked into gear this year. So congratulations to the Sunshine Act for making it to our top 10. All right, number 9. Just yesterday, the Supreme Court told Arizona lawmakers that they can't put unscientific limits on the medications that doctors use to help women with abortions. In recent years, more women and doctors are using medications instead of surgery to terminate pregnancies. But the anti-choice crowd out there, they have the Arizona legislature trying to put lots of unnecessary restrictions on these doctors and the medications, and it actually was going to threaten a lot of women's health care in the state of Arizona. And thanks to the Supreme Court, these lawmakers have been told that they can't do that. And we thank the SCOTUS folks for telling Arizona to get out of the exam room and leave these decisions to women and their doctors. All right, number 8 goes to the Obama administration for their $1 billion investment in early childhood education. We've talked a little bit about the importance of education as a social determinant of health, and we're learning so much more about all the positive impacts that come out of good preschool and the impact that good preschools have on child health, on toddler health, on adolescent health, and beyond. And we're going to come back to this issue when we come back in 2015. But this $1 billion investment in giving our kids a strong start, a healthy start, it's going to pay off huge in the long term and in the short term for all of us. So thank you to the Obama administration for that serious commitment to early childhood education. Number 7. All right. So during this past election cycle, voters in Colorado and North Dakota defeated personhood ballot initiatives. So these were extremist ballot initiatives that were trying to recategorize a fetus as a child, and the voters simply said, no, we are not doing that. There is still a lot that needs to be done for reproductive health across this country. And the Dr. America Show is going to talk about these issues when we come back in 2015. But defeating these kinds of misguided, non-scientific ideas in reproductive health policy is really important. And we thank the voters of Colorado and North Dakota for stopping extremism at the ballot box. All right, number 6. So, in this episode, we've been talking about paid sick days, and our number 6 on the list of health justice accomplishments for 2014 are the many laws and initiatives passed in states and cities across the country, just like Kristen was telling us about. Massachusetts passed a ballot measure to expand paid sick leave for more and more workers. Similar policies passed in cities like Oakland, California, San Diego, and in Montclair and Trenton, New Jersey. as well as in New York City. So these policies were brought up in lots of state legislatures, and the more that we make our voices heard, the more that they're going to not only get out of the state house, but they're actually going to be in full effect in our workplaces. So let's keep up the good fight, folks. Congratulations to Massachusetts and those cities in California and New Jersey and New York City for making this happen. All right, here we are. We're coming up to our top five. Number five goes to the medical students and health professionals who participated in White Coats for Black Lives. Students from 70 schools across the country wore their white coats for die-ins and other protests to protest racial profiling and police brutality, to protest the murders of Eric Garner and Michael Brown by police officers who then escaped punishment. This is a health policy accomplishment mainly because it proves that what we've talked about on the show a couple of times before, that racial profiling has a health impact, and there are lots of us health professionals who want justice. And if you haven't seen the pictures yet, they're really inspiring. They're going to make you believe in the future of modern American medicine. And we're going to have links posted on the Dr. America Facebook page. You're definitely going to want to check it out. And thank you to everybody who participated in White Coats for Black Lives. Okay, number four. Number four goes to Obamacare because its second enrollment period has been really successful. By December 5th, there were 1.4 million people who had signed up for health insurance policies through healthcare.gov. Yes, that healthcare.gov, the one that had a whole bunch of glitches back in October 2013. But thanks to the diligence of fixer-uppers and health navigators, we are on track for helping over 9.1 million of our fellow Americans getting signed up for health insurance by the time this enrollment period closes in February. So that's a huge accomplishment. Way to go at everybody who is making the Affordable Care Act workable and real for average Americans. We thank those health navigators out there, and you are our number four. Okay, number three on the top 10 health justice accomplishments of 2014. It goes to Washington State. Voters there passed a ballot initiative for universal background checks on gun sales. We mentioned this in last week's broadcast, but it's worth repeating and celebrating because it is a major step in the right direction for stopping the public health problem of gun violence. Congratulations to voters for standing up to the NRA lobbyists and gun industry lobbyists. We're seeing this kind of progress sprouting in other parts of the country, and I thank advocates and voters for that. Okay, we're coming up on number two. Number two is going to be a little unusual, but stick with me. It does make sense as a health justice accomplishment. It's mainly that I'm proud of Time Magazine for awarding the Ebola fighters, the various doctors, nurses, and public health experts fighting to stop the Ebola outbreak as their persons of the year. I'm calling that an accomplishment because these public health workers have done an incredible job of controlling this outbreak, and they deserve our gratitude and respect. But unfortunately, they have not always received it during the course of this outbreak. As I mentioned in our pilot episode, Nurse Casey Hickox was subject to an unnecessary state-policed quarantine. And, there's just been a lot of public derision of many of our public health workers, a lot of them volunteers, who have done tough, dangerous work of taking care of our brothers and sisters in West Africa. And so I thank Time Magazine for reversing this cultural trend in the conversation and moving us away from stigma. And thank you to the Ebola fighters. All right, here we are. Our number one health justice accomplishment of 2014. Our number one accomplishment is the Senate's confirmation of Dr. Vivek Murthy as our next Surgeon General. I am so excited for this accomplishment because we have been without a Surgeon General for too long. And when you consider the health challenges this country has been facing, it is great to have somebody with Dr. Murthy's intelligence, with his ingenuity, with his heart, finally on this job of being Surgeon General. This is a great, great, great development for American public health. This is also a huge win for advocates of gun violence prevention and for those of us who approach gun violence as a public health issue. Dr. Murthy's confirmation was stalled for over a year because he had tweeted just after the Sandy Hook shooting that happened in December of 2012 that gun violence is a public health concern. Remember, this is a position that is not all that different from the hundreds of medical organizations and public health groups that have supported Dr. Murthy and have had similar policy statements for many years about gun violence as a public health threat. And Dr. Murthy's tweet was really not any different than what hundreds and thousands of doctors and nurses have been telling us for a very long time. But despite all of that, the NRA lobbyists and the gun industry lobbyists, they used a lot of melodrama and a lot of fear-mongering tactics to scare senators. And for a while, it looked like those tactics were working. And those same tactics were amplified after the Senate came back from their Thanksgiving break. And Dr. Murthy's confirmation was on the to-do list for this lame duck Senate. And, the NRA lobbyists made it clear that they were going to score the Surgeon General vote. And if you scored poorly as a senator, the NRA was not going to, let you forget it. They were going to give you a poor grade. And, they really did their best to threaten our elected leaders. And, the good news is that those tactics failed yesterday. Dr. Vivek Murthy is now our Surgeon General. To be clear, during the confirmation hearing back in spring of this year, Dr. Murthy emphasized that he was not going to be using the Surgeon General office as a bully pulpit for advocating for gun safety. Instead, he intends to, focus on educating the public about obesity, about tobacco use and smoking and the threats that those habits cause. And he was actually going to, really, focus on the importance of reducing stigma about mental health. It's a really important part of our public health conversation that hopefully the gun lobbyists will, recognize that he was never a threat. And that, and hopefully the public health community will have more time and opportunity to celebrate Dr. Murthy's accomplishment. All that being said, as a health justice advocate, I'm still grinning over the NRA's losses. Now, I'm going to spike the football in as classy a way as possible as I can because it's really tempting to gloat inappropriately, but I won't. Instead, let's use this moment of triumph as proof of what we as advocates can accomplish. There is a long war and struggle ahead of us, and that struggle has got a lot of challenging fronts. We've got the gun violence front, we've got paid sick leave, we've got racial profiling, hunger, and the list goes on and on. There is no shortage of public health challenges with very long struggles ahead of us. But in celebrating Dr. Vivek Murthy's confirmation as Surgeon General, we can celebrate that, that this is people power over the powers of industry money and really ugly politics. Health justice, it may be temporarily delayed, but it will not be defeated. Not if we, the people, give a damn. We can do better. We must do better. And this list of health policy accomplishments, it proves it. Thank you all so much for all your hard work in health advocacy. Thank you for supporting this show. And, we'll have our next show in 2015. Until then, I urge you guys to check out our updates on Facebook and Twitter. Our Twitter handle is at Dr. America Show, all one word. And our Facebook page is simply Dr. America. We're searchable. And, please join us in those conversations. And, feel free to keep posting those pictures of your flu shots hit me with your best flu shot. But what I'm really excited about the Dr. America show is that we are building this community of health justice advocates, activists, of our intellectuals who have been doing a ton of important research about what will make us healthier, more just, and that we're bringing in the community who are part of that struggle, who are part of that hard work, and we're giving them a voice too. So I really, really thank everybody at the We Act Radio Network for making it happen. I thank all of our guests that have come on the show this year and contributing their wisdom and insight and inspiration. And I'm really excited to do it all over again in 2015. So from all of us at Dr. America, we wish you happy holidays and a safe, happy, and healthy new year. Salud, everybody, to your health.